I'm going to make a short demonstration on how to examine the cervix or walk the cervix where you suspect a cervical tear after vaginal delivery. So with your assistant, you need two seam speculum with long blades. One will be anteriorly and another one posteriorly over the posterior vaginal wall. So using your clamps, you need special cervical clamps or even a sponge holding forceps can help to during the examination. At least 2 or 3 can do a job for you. So this is clamp number 1. Place the first clamp on the anterior lip of the cervix at around position 12 o'clock and grab it there. With your assistant, giving you a good visualization, you'll use the next clamp at around position 3 or position 2 and then examine that portion of the cervix. If there is any tear, identified tear, you can clamp it. If you don't identify any tear, you move the first clamp to around position around 5 or position 6 and then examine that portion of the clamp with your assistant using the seam speculum to give you good vision. And if you don't identify any tear there, you again continue walking the cervix and then move the second clamp to around position 8. Then if you identify a tear, just like in this case, we have a tear at position around number 9. So when you identify this tear, ensure examine to find out whether it's bleeding. Number 1, can you see the apex? Like in this case, we can identify the cervix. If there is any active bleeding around the apex, you can use one clamp to clamp the bleeder. And if the edges of this tear are also bleeding, adjust the clamp so that they can arrest the bleeding on one edge of the tear and another clamp on the other edge of the tear. Now, once this is done, you can proceed to repair the tear. If it's a small tear, you may do an attempt to repair it on labor ward. However, if it's a big tear like this one, you may need to shift to theater at this point so that you can repair it in a good lithotomy position with good visibility from the theater lights. In situations like in our health center 2, health center 3s, where we don't have a theater, you should refer the patient in this position when the tears are clamped. Before you end your examination, ensure the mother is no longer bleeding from any tears before you refer. Otherwise, just referring without ensuring she's not bleeding may be futile. Thank you.
Our take-home messages. Remember I.C.E.T. The first is identify the tear, clamp the tear, ensure bleeding has stopped. Then you can transfer to theater or to another facility.